You need to watch this if you struggle with fertility. Today, we're diving into surprising factors that could affect your fertility. From daily habits to hidden environmental influences, your reproductive health is shaped by more than you think. We're cutting through the noise and giving you clear, evidence-based info you can use. Age, sleep, plastics, and more. Let's break down what really matters. We'll cover 7 key areas that research shows can impact your ability to conceive. This isn't about fear, it's about giving you the knowledge to make informed choices. Ready? Let's get into it. Alright, let's start with the big one: age. This is probably the most well-known factor, but there are some nuances that are often missed. For women, the link is quite direct. You're born with all the eggs you'll ever have, and as you get older, both the quantity and the quality of those eggs decline. This process starts to speed up around age 35. This doesn't mean it's impossible to get pregnant after 35, not at all. But it does mean that statistically, it can become more challenging. And the risks of certain complications, like miscarriage and chromosomal abnormalities, increase. It's a biological reality that we need to acknowledge so we can plan accordingly. It's not a deadline, but it is a timeline that's important to be aware of. But here's the part of the conversation that often gets left out. Male fertility is also affected by age. It's not as dramatic a drop-off as it is for women, but it's a mistake to think it doesn't exist. As men get older, typically starting around age 40, there can be a gradual decline in testosterone levels, sperm motility, which is how well the sperm can swim, and sperm morphology, their shape and structure. There's also an increased risk of DNA fragmentation in the sperm. This can make conception more difficult and has also been linked to a higher risk of certain health issues in the child. So the takeaway here is that the biological clock isn't just for women, it's a factor for men too. Next up, let's talk about weight. This is a sensitive topic, but it's incredibly important for reproductive health. Our body fat isn't just sitting there, it's an active endocrine organ, meaning it produces hormones. And when it comes to fertility, hormonal balance is absolutely everything. If you are significantly overweight, the excess adipose tissue can lead to an overproduction of estrogen. This can disrupt your menstrual cycle, interfere with ovulation, and make it much harder to conceive. For men, being overweight or obese is linked to lower testosterone levels, reduced sperm count, and decreased sperm motility. It can also increase the risk of erectile dysfunction. On the flip side of the coin, being significantly underweight can be just as problematic. If your body fat percentage drops too low, your body can go into a kind of survival mode. It senses that it doesn't have enough energy reserves to sustain a pregnancy. In response, it can shut down non-essential functions. And for women, that often means shutting down ovulation and menstruation, a condition known as hypothalamic amenorrhea. For men, being severely underweight can also negatively impact sperm quality and production. The key here, for both men and women, is finding a healthy, stable weight for your body. It's not about a number on the scale, but about hormonal balance and overall wellness. Let's move on to something we all experience: stress. We often think of stress in terms of its mental and emotional toll, making us feel anxious or overwhelmed. But chronic, unrelenting stress has profound physical effects, and your reproductive system is particularly vulnerable. When you're constantly stressed, your body is flooded with cortisol, the primary stress hormone. High levels of cortisol can throw your entire hormonal symphony out of whack. In women, it can interfere with the signals from the brain to the ovaries, potentially delaying or even preventing ovulation. It can mess with your cycle length and regularity, making it difficult to track your fertile window. For men, chronic stress can have a similarly disruptive effect. It can lower testosterone levels, which in turn can reduce sperm production. Studies have also shown that men who report high levels of stress tend to have a lower sperm concentration and more sperm with motility and morphology issues. It's your body's way of saying, hey, we're in a fight or flight situation right now. This is not a good time to reproduce. Now, I'm not talking about the occasional stressful day at work. I'm talking about that long-term, grinding stress that never seems to let up. Managing that stress through things like mindfulness, exercise, or therapy isn't just good for your mind, it's critical for your fertility. This one shouldn't be a huge surprise, but honestly, the extent of the damage might be. So, let's talk about smoking. The toxins in cigarette smoke, We're talking about thousands of chemicals like nicotine, cyanide, and carbon monoxide, are systemic poisons. They travel through your bloodstream and wreak havoc everywhere, including your reproductive organs. For women who smoke, these toxins can damage the eggs in your ovaries, speeding up the rate of egg loss and essentially accelerating the aging of your ovaries. This can actually lead to entering menopause 1 to 4 years earlier than non-smokers. It also increases the risk of miscarriage and ectopic pregnancy. And men are absolutely not off the hook here. Smoking is incredibly damaging to sperm health. The toxins can cause oxidative stress, which damages the sperm's DNA. This can lead to lower sperm counts, poor motility, meaning they can't swim properly, and abnormal morphology, meaning they are misshapen. All of this makes it much harder for a sperm to successfully fertilize an egg. Even if fertilization does occur, the damaged DNA from the sperm can increase the risk of miscarriage and potential health problems for the child. The good news? The negative effects on sperm can begin to reverse relatively quickly after quitting. It's honestly one of the most impactful changes you can make for your fertility. Next, let's discuss alcohol. Social drinking is a big part of many cultures, but when it comes to trying to conceive, moderation is really the key. For women, heavy or even moderate, regular alcohol consumption can disrupt the menstrual cycle and interfere with ovulation. It can alter estrogen and progesterone levels, the two key hormones that regulate your cycle. Even drinking during the second half of the menstrual cycle, after ovulation, has been linked to a decreased chance of conception. The official advice from many health bodies, like the CDC, is that there is no known safe amount of alcohol to drink during pregnancy or while trying to get pregnant. For men, the story is similar. While an occasional drink is unlikely to have a major impact, chronic heavy drinking can be very detrimental. It can lower testosterone levels, raise estrogen levels, and cause testicular shrinkage, all of which can lead to reduced sperm production. It can also affect the shape, size, and motility of the sperm that are produced. Binge drinking, in particular, seems to have a significant acute negative effect on sperm health. So, if you're actively trying to conceive, it's a really good idea for both partners to critically evaluate their alcohol intake and consider cutting back significantly or abstaining altogether to give yourselves the best possible chance. This is a big one that we're only just beginning to fully understand: environmental toxins. We are surrounded by chemicals in our daily lives, from the air we breathe to the products we use and the food we eat. Many of these chemicals are known as endocrine-disrupting chemicals, or EDCs. This means they can mimic or block our natural hormones, creating chaos in our finely tuned reproductive systems. Common culprits include things like BPA, often found in plastics and the lining of food cans, and phthalates, found in everything from vinyl flooring to personal care products like lotions and perfumes. Exposure to these can impact egg quality and interfere with ovulation in women. For men, exposure to these same chemicals, as well as things like pesticides and heavy metals found in some industrial workplaces or contaminated water, can have a profound effect on fertility. These toxins have been linked to lower sperm counts, decreased motility, and increased DNA damage within the sperm. The challenge is that these exposures are often low-level but chronic, happening over a long period. While you can't eliminate all exposure, you can take steps to reduce your load. This could mean filtering your water, choosing glass over plastic containers for food, opting for fragrance-free products, and eating organic produce when possible to reduce pesticide intake. It's about being a conscious consumer. Finally, let's talk about something we often sacrifice in our busy lives: sleep. You might not think of sleep as being related to fertility, but it is absolutely crucial. The same part of the brain that regulates your sleep-wake hormones, like melatonin and cortisol, also regulates the release of your reproductive hormones. When your sleep schedule is erratic, or you're consistently not getting enough quality sleep, you disrupt that entire command center in your brain. For women, this can lead to irregular menstrual cycles by affecting the hormones that trigger ovulation, like luteinizing hormone, or LH. This isn't just about women. Men who consistently get poor sleep, whether it's too little, too much, or at inconsistent times, have been shown in studies to have lower testosterone levels. One study found that sleeping 5 hours a night for just 1 week decreased testosterone levels by 10 to 15% in healthy young men. Poor sleep has also been linked to lower sperm counts and motility. The bottom line is that your body does its essential repair and regulation work while you sleep. Prioritizing 7 to 9 hours of quality, consistent sleep per night is one of the foundational pillars of good health, and that absolutely includes your reproductive health. Wow, that was a lot of information, I know. We covered everything from age and weight to stress and the very air we breathe. My goal today wasn't to overwhelm you or add to your anxiety. It was to empower you with knowledge. Understanding these factors gives you a toolkit of actionable steps you can take to support your body's health. Whether you're thinking about starting a family soon, in the distant future, or just want to optimize your overall wellness, these principles apply. Remember that fertility is a journey, and sometimes it's a team sport involving you, your partner, and your healthcare providers. And that brings me to my most important point. This video is for educational purposes, but it is not a substitute for professional medical advice. If you have concerns about your fertility or are planning to conceive, please talk to your doctor or a fertility specialist. They can provide personalized advice based on your unique health history and circumstances. They can run tests, answer your specific questions, and guide you on the best path forward for you. Don't rely on Dr. Google or even Dr. Mike for your personal diagnosis. Use this information to have a more informed conversation with your healthcare team. Thank you so much for spending this time with me today and diving into such an important topic. I hope you found it helpful and empowering. If you did, please give this video a thumbs up, and don't forget to subscribe to the channel and hit that notification bell so you don't miss out on more health tips and deep dives. And as always, I want to hear from you. What surprised you the most? Do you have any questions? Drop them in the comments below. Stay healthy, stay curious, and I'll see you in the next video.